So I wanted to start our discussion this morning by taking some time to talk a lot about what happened in the past legislative session and how that will affect mental health and criminal justice issues going forward. This year, the legislature decided to invest really a significant portion of additional dollars in mental health, as probably many of you know already this morning. So we're going to take some time to talk about what are some of the issues that these additional investments will help us to address in criminal justice and mental health, and then how we can tell whether or not those investments are working going forward. So one of the big investments that lawmakers decided to make this session was an investment in a pilot program in Harris County that will help that county to deal with its sort of cycle of folks with mental health issues who are coming in and out of the jail there, hopefully prevents some of them from continuing that cycle. So I was hoping that, Sheriff Garcia, you could talk with us a little bit about how that program is going to work and what changes you hope to see from it.
Thank you so much. And if I had gotten the hashtag sooner, I already tweeted before I got the hashtag, so I have to do that a little later. But first of all, thank you for having us, and this is an important conversation. We were so fortunate that in this past session, our state senator, Joan Huffman, along with our county judge, Ed Emmett, worked to get some money appropriated specifically to Harris County to help us find out how we can contend with those individuals who cycle through the county jail on a regretfully very frequent basis. We just had a recent coordination with various stakeholders. We're still putting the pieces together, but optimally. The goal is that we want to deal with people and their conditions out in the free world. We want to deal with them in clinics, in the therapeutic environments that they need, not in the county jail. A healthy inmate will cost us somewhere in the vicinity of $60 a day to incarcerate. Someone who is on psychotropic medication can cost us anywhere between $200 to $400 a day. And then we obviously recognize, and I have recognized as a sheriff of Harris County, that we have a lot of people who are in jail, not because they're bad people, not because they're gang involved, not because they're prone to carry guns or knives and cause harm to others, but because they're sick. And so when I was a member of City Council, we worked to put another program together. So we're hoping that what is called now the Crisis Intervention Response Team will work very much in coordination with this new pilot program that we're assembling in Harris County.
Can you talk to us a little bit about if you see that pilot program becoming a model that other counties can implement and how that might happen?
We're hoping to. I mean, we obviously don't have all the answers, but we're going to be working extremely hard to figure it out to the extent that we can. The fact that the state appropriated some dollars to us, I think, is hopeful and exciting to see where they're thinking, especially in the environment that we've been in as of late. Secondly, the idea is that if we can figure out a way to jail divert, is the concept. Keep people, although the principal number for mental health issues that people call is 911. And even though that may be the case, and even though we may not be able to effectively change that in the near future, the idea is that law enforcement becomes much more synchronized and coordinated and adaptive to the mental health community, and those professionals, those clinicians, those doctors and have a system, if you will, that we can triage them in the community rather than getting into the jail. So the idea is that the pilot program will be successful. The idea is that we'll learn how to work as a total community, and then the idea is that we can replicate that for other parts of the state.
So maybe you could talk with us a little bit from your background, knowing so much about conditions in prisons, about why that's not really the best place for folks who are dealing with some sort of mental health crisis, and perhaps how we should deal with it instead.
Sure. I think we could all agree that the jails have become a dumping ground for the mentally ill, and it is about as inappropriate a place for them as can be. I think we have maybe 8 times as many people with serious mental illness in the prisons and jails in the state as in psychiatric hospitals. So it really has become a dumping ground. But the facilities themselves are inappropriate. The inmates who have mental illness are among the most vulnerable population, much more subject to physical assault, sexual assault. They also tend to be less compliant with the rules, and so they act out much more often than other inmates. Many times they end up in segregation, administrative segregation, where sometimes those extreme isolation conditions can cause their mental health conditions to deteriorate, or can actually create some of those problems for them. When inmates are placed in administrative segregation, they are locked up usually 23 hours a day without human contact in many cases. If they can get recreation time, it's solo recreation in a slightly larger cage. They eat in their cell, they have really no interactions with other people. And those kind of conditions, whether it's in a prison or a jail, can just lead to a deterioration of mental states.
And it's not only with adults that we see these kinds of conditions occurring, right? I mean,
Absolutely.
We've seen some of these problems at the juvenile level as well.
Absolutely. In the juvenile setting, it's sometimes hard to know exactly how much it's happening at the local level. A recent report I wrote about conditions within TJJD showed that the youth are being put into security settings, which is the juvenile equivalent of administrative segregation, with astounding frequency. Sometimes in the course of a week, you may have more youth locked up in security than there are youth in the entire agency, confined in the agency. We found 93 youth with more than 300 so-called referrals to the security setting over the course of their average 14-month stay. And while the conditions there are not quite as extreme as in the adult setting, it is still a place where they are removed from their interactions with peers and where they don't have access to the same level of programming that they would if they were in the general population. So it's an issue of extreme concern.
Perhaps this is a good place for you to jump in and address that. Yeah. Why do we see in TJD so many youths in this sort of solitary environment, these security situations?
Well, I think that's changing every day. I think right now you'll see no more than 8–10%. I think with the issue of mental health and the youth that have those acute to moderate to severe mental health issues that are currently at either our Corsicana facility or at Ron Jackson for females, you're dealing with about 90 youth total of a population of about 1,300. And the security unit at Corsicana is a crisis stabilization unit. So that makes a big difference. Now, that's not to say we don't have a lot to improve on, and we're doing that. You know, our involvement with trauma informed care, our use of evidence-based services, our relationships with UT, the Hogg Foundation, the Metals Foundation, and others speaks to the quality of what we want to achieve very quickly. On the other side, you know, we're very, very grateful to the legislature. An infusion of $15 million into the communities, the 168 probation departments to provide care, mean a great deal to help divert youth that have mental health issues away from that deep end. Again, I'm very proud from our local collaboratives, especially in our urban areas. And so when you look at the metropolitan areas of Texas, you see the best happening for youth in the mental health arena. The monies that were derived from this legislative session can help bring forward those services to the rural areas of our state, too.
Can you talk with us a little bit about how TJJD is going forward with the closure of Corsicana and how that's going to affect how you deal with youths in the system who are struggling with mental health issues?
Very good. Again, the issue right now is deriving that plan and bringing it forward to our board. That'll happen on August 30th. The facility chosen based on the mandate from the legislature was obvious. It was a structural decision. Many of the youth that are at our Corsicana facility engage in non-suicidal self-harm. That means they'll use anything and everything to hurt themselves. And that particular facility, 130-year-old facility that has buildings upon buildings that have been rebuilt, they find access to glass, tile, and other objects to hurt themselves. So from our standpoint and the experts that have looked at that predicament for many, many years, Corsicana was the residential program recommended. We're taking a very methodical approach to the transition of those youth if the Legislative Budget Board approves that recommendation. Not only have we looked at where those youth would go, upon the recommendation of UTMB, that facility would be our MART facility, which is 45 miles west of Corsicana. That facility has a space, it has the ability of infirmary, it has separation of generalized population from that specialized population that have mental health issues. It has separation of schools. So again, we think that's the best place. Right now, we're waiting anxiously for a decision so the staff positions we've held open can be allocated for those staff at Corsicana. The best thing for those youth that are at Corsicana to have the same staff members that are dealing with them there transition with them, both from an education arena or direct care arena. So that's where we are now. One of the nice things I'd like to really thank Kat and her staff and advocates is that they recommended a strategy that we hadn't thought about, and I'll admit it. They said, what are you doing about case reviews? And so this month we're going individually to every case, the 77 youth at our Corsicana, and re-reviewing their cases to see, is there a different alternative, a better alternative? And then we've added a second tier of review, and that will be with advocates. That'll be with experts from outside our agency to say, have you thought about this particular program for this particular child? I know we get support from leadership to say, put that youth in the best location possible. And so we're excited about that as well.
Well, Kat, maybe you can talk with us about these reviews and why they're so important and how you notice that sort of gap in the system there.
Sure. I mean, my agency does a lot of direct client services for youth, primarily in Corsicana, but in all the TJJD secure facilities. And as we look at closure of the facility, one thing that occurred to us is perhaps not every youth needs to be there. And so having this sort of individualized assessment, not only of have they met their minimum length of stay, are they eligible to return to the community? Some of the youth, based on the structure of their sentence, are not going to be eligible to return, but clinically, how can we serve these youth who have very significant needs, potentially in a less restrictive setting than a state-operated secure facility? And I think that there's certainly an appealing aspect to that from facilitating treatment for the youth. State secure facilities are also, it's a high-ticket dollar item for the state. So I think that looking at some of these, for lack of a better word, post-adjudication diversion opportunities for this population carries a lot of opportunity.
So one of the things that has been a discussion for the past several years leading up to this past session is one of the reasons we see so many people, both at the juvenile level and the adult level, in secure facilities is because there aren't avenues outside of jail to deal with them. And so I'm wondering if maybe, Kat, you could continue this conversation and talking a little bit about what are the opportunities for improvement that we hopefully will see coming out of the investments that made by the legislature this past session, and maybe what are some of the missed opportunities as well?
Sure. Well, I do want to say, as an advocate, this was a tremendous legislative session from a mental health standpoint. The focus around mental health, the positive conversation around facilitating access to services. Again, as an advocate, it was just such a pleasure to work in that setting, and I think the legislature deserves a tremendous amount of credit for focusing on that and listening to the Department of State Health Services in terms of identifying what they need. I've certainly never seen in my tenure doing policy work where almost every exceptional item requested by the department was funded. at least partially. And so this type of investment, I think, is huge. The one thing, from my client standpoint, from the kids we work in both the criminal and juvenile justice system, that I think is extremely important was the $48 million investment to reduce the wait lists. As of, I think, the beginning of the legislative session, over 6,000 people who are medically indigent, meaning they don't have a third-party payer source, don't have Medicaid, were waiting for services through the local mental health authorities. Those individuals may be accessing public mental health services, but doing so at great expense through state hospital utilization of crisis services. Because really, if you don't have that third-party payer source, what you're entitled to is crisis services. So I think that among the many great bills that passed, that's certainly one I would point to. I think, a large part of the conversation that went on that's still unfinished during the session was sort of the role of the ACA in Texas, specifically Medicaid expansion. I think that the good news is whether Texas expands Medicaid or not, today, tomorrow, in the future, there are benefits under the ACA that persons with mental illness and substance use disorders can benefit from. For example, the essential health benefits includes mental health. That's one of the things that must be offered by the programs. However, I do think that there is an opportunity for an ongoing conversation about it. I think the Secretary Sebelius was in Austin a couple of weeks ago and indicated very much that she wants to have a continuing conversation about a Texas solution to expanding Medicaid.
For the Sheriff and Mr. Griffiths, I wondered if you could talk a little bit about why the session was different. Both of you have been through a number of sessions, particularly you, Sheriff, lobbying for additional funds at the local level for mental health. Why did lawmakers, from your perspective, finally see this session that it was time to make that investment? Was it shootings that we've seen nationally on that scale? Was it more just they got tired of your asking for it?
I hope that would have been the case, but I think that, well, two things. One is that there's a pendulum swing occurring right now, and I think we've gone from the aspect of where defunding the programs for whatever the philosophy was at the time to lock them up and let law enforcement deal with it and put them in jail and contend with it and then stabilize them, get them ready for trials, but not really provide a long-term approach to the challenges that are occurring. I think we're back to finding and understanding that mental health has become, I think the legislature has seen it and lawmakers are seeing it as a common threat that maybe society is experiencing more and more these days. Mental health, the matter of social economics, is tying so many of us together that I think it's forced the legislature to recognize that this is not someone else's problem. This is a community problem. We have to understand it. We have always associated a lot of this to our military, but it's not just the military anymore. And then we're understanding better that even kids are suffering from mental illness as well. So I think that part of it is that they've just become much more informed and educated on the issue. I think that the advocates in the community, law enforcement in particular, has become much more vocal in the lobbying as a cohesive, unified group on the issue. Look, as you introduced me, you indicated I'm the largest mental health facility in the state of Texas. That's challenging itself, but when you look at my contemporaries across Texas, those that are in rural communities, they have to put 2 deputies in a patrol car, drive 8 hours just to deliver one person to a mental health institution. And that doesn't make any sense. And so I think that as we've discussed it, as the media has been very effective at documenting it and telling the story, I think it's made it easier and it's provided the legislature with a good degree of understanding that, you know what, we've got to confront this, we've got to provide some solutions. And yes, the shootings across the country and across the state have provided another degree of fodder for them to understand that we've got to do something about this issue. the other side of it too is that in prison, maybe not as quickly, but in the county jail, folks go back out to the community relatively quickly. And without some more comprehensive approaches and systems in place, they're going to come right back sometimes in hours, if not within a few days to a few weeks. And that is an incredible waste of money, the taxpayers' money, to allow the system to function as such. And so all of this has been brought to the local level, has been brought to the legislatures at the state level, and even our federal counterparts are talking about it as well. So I think we're at a good place where people are understanding it much better than they ever have before.
Michele, the sheriff mentioned something that I hope we can maybe talk a little bit more about, which is that the folks that are going back into our communities, it's not like people who go, everyone who goes to jail or to prison stays there forever. And so at some point, they come back and they're our neighbors, and they work with us in the community. And the conditions sometimes that they face, particularly if they have mental health issues already going into prison, don't necessarily make things better. So I was wondering if you could talk about perhaps a little bit from the legislative perspective, if anything was done this session to really look at particularly the use of isolation in prisons and jails.
Sure. The legislature agreed to have a study conducted of the use of segregation in both the juvenile setting and in the adult settings. Part of the problem is that we don't have much data. And so it's very hard to make policy decisions about should we use it, shouldn't we use it, how much should we use it, who's in there. We're talking about anecdotes for the most part. And so we need good, hard research on these things. The legislature, I believe they didn't fund it, but they called for a study to be done. And hopefully, if that study is in fact conducted, we will come back to the next legislature with some good information. Advocates have been calling for reducing the use of administrative segregation in prisons and in juvenile settings. Whether that will happen or not is still very much an open question, but you can't even begin to determine policy without data. And if I could also just respond to one other point about the legislature, what the legislature did this session in terms of funding. I mean, I certainly share everyone's enthusiasm for the sea change that happened, but I think it's important to keep it in perspective that Texas had been dead last for many, many years among all states in the country in terms of funding for mental health. And so, yes, we have increased that funding, but it's still very, very far from where we need to be.
Amen.
That's a great point.
Well, maybe all of you then could start talking now about how we're going to know whether that funding is making a difference and what sort of developments you are looking for to see whether those dollars are really improving the way we deal with mental health here in Texas.
Well, let me just say that I think that's an important point, and everyone here, I think we're preaching to the choir, needs to speak up, because if I remember correctly, I think a significant portion of the funding is provided to the most critical side of mental illness. And so all of the preventative, the early work that could be done to prevent critical stages of mental illness isn't being properly funded yet. And so, and then as you talk about these issues on how folks are contended with in isolation, you got to remember that law enforcement is barely understanding this. Jails are barely figuring out how to manage this population that's been coming to us. We've just been dealing with it, but now there's much more science being brought into the county jail facilities.
I think for the juvenile side, the outcome will have to be out-of-home placement. We have to see a reduced number of those, I mean, to show that those enhanced funding dollars really paid off, not just to the state side, because we've seen tremendous reductions. You know, in your earlier question, you know, what was the mindset of legislators being open about it? Well, remember 5-6 years ago, there were 5,500 youth in our secure state facilities. Today, there are 1,100, and we want to see even fewer youth there. So with Senate Bill 603 from the 82nd legislative session, there is a real directive, deliberate directive to provide as many resources into the community as possible to divert even more youth. So that is our goal, using evidence-based services, research-supported, to find alternatives for families rather than having the youth be incarcerated.
I think this is a question for both Kat and Michael to talk about is, as we see more and more of these youths being transitioned to spending more time close to their communities, close to their homes, which most folks agree is a good place because they're close to their support systems and usually better services. What kind of accountability and oversight is in place at the local level to ensure that those youths who are staying are getting that better treatment and that what they're receiving close to home is at least as good, as, if not better, than what they would have received at a state facility?
Go ahead.
Well, I think it's a great question, and one of the things, people often look to recidivism rates, drops or increases in those, is that successful? I think for youth, there are just so many other outcome measures that we need to look at: success in school, use of substances, and I think that some of that framework was put in place during the 83rd legislative session, not necessarily, I would defer to Mike on this, specific to youth involved in the juvenile justice system, but increasing sort of outcome reporting, taking a more holistic look at the public mental health system through a 10-year, developing a 10-year plan. Do we have the appropriate number of forensic beds? Do we have the appropriate number of civil beds? And how can we ensure that we're using state dollars in a cost-effective way, but also getting the outcomes that we want? And I think that one of the lessons learned to date, and one of the things that I think the legislators said very clearly, is we don't want to make this investment and not know where the dollars went and what the real-time outcomes are. So I think it's going to be incumbent upon TJJD and the Department of State Health Services to put in place those outcome measurements as they were directed to do.
Very intentional. Again, the legislature directed us to provide 2 additional staff to our research department. In addition to that, through an outside source, the Council of State Governments is going to do a very comprehensive study of outcomes of youth, both from the local levels and the state secure level. Looking at level of risk being the same, how does each youth do in those 2 different settings? So we'll know in a matter of months, the outcomes from that. I think, as Kat said, it's incumbent upon the Texas Juvenile Justice Department through the regulatory authority to ensure that those services at the local level meet the needs of these youth.
Is that through the Ombudsman's office that you ensure that those facilities are providing what they need, or how is that done?
The Ombudsman right now is responsibilities at state services and those that we contract. But I will say that there's not a county in the state that doesn't welcome Ms. Unruh to their location. So in the future, if that expands, I think the counties would be open to that. Her staff are limited, but she does a tremendous job. And so she is a true advocate for those youth.
So I'd like to, we have just a few minutes left before we open it up for questions, and I'd like to hear from each of you about sort of what you see as the next steps. Probably never too soon to start thinking about the next legislative session. So as we move forward, what areas are ripe for legislative action?
Well, let me touch on one area that we haven't talked about yet, and that's the whole so-called school-to-prison pipeline issue. The problems that kids who are in schools are facing, so many kids with either undiagnosed mental disorders or ones who have been diagnosed are acting out in schools, and their misconduct is often criminalized. Through the ticketing process, we give tickets to kids who act up in schools, criminal tickets, where they have to appear in adult municipal court. We highly overuse suspensions and expulsions from schools and place these youth in settings that are very inappropriate for them, rather than getting them the services and the treatment that they need. If we could do a lot more to address those issues of youth in schools, I think that we can cut off a lot of the incoming population for our juvenile justice system and for the adult prisons. And the legislature has been interested in this issue for sure, but it would be nice to see even greater attention paid to that next session.
There's been a request, at least, for a DOJ investigation into some of those activities in the Dallas area. What do you think that will tell us?
It's a little hard to know, and it's unclear exactly to what degree Dallas's actions in terms of how it handles truancy and other kinds of misconduct, whether that is a similar process to how it's working in other counties. So I think it will be an important investigation if DOJ decides to conduct it, but beyond that, it's a little hard to know. Wait and see.
I want to add a little bit to that conversation as well, is that we're talking about mental illness. We haven't even discussed individuals that are challenged with developmental disabilities. That's also a small portion of my population, but it's also folks who get victimized, exploited, and get arrested for a lot of things at the abuse of others. So we got a lot of challenges, but what I'm hopeful will happen is that, number one, our challenge is that we've got to demonstrate some success with this pilot program, make sure that we are fixing systems and processes and working together as a healthcare community, and really building on the ability to do better at jail diversion. My staff member, Director Alan Bernstein, was just reminding me that we used to say that on any given day, 25% of our jail population was on some type of psychotropic medication. That's no longer the case. It's now closer to 30%. So we need to move the needle in a different direction. And so I think people will be watching very intently on what's occurring with the pilot project. We are expanding our crisis intervention response team to help us with the jail diversion, but as it's all been said, unless there's that capacity out in the community, they'll ultimately come back to the county jail. So we got some challenges in front of us, but I'm hopeful that we've got something of a foundation to build on and demonstrate a new way of thinking on this issue.
From the juvenile justice perspective, it's presenting leadership a model that is the best resource for the child, no matter where that is. So regionalization, less congregate care programs. We are going through a process now of what we call leveling. Staffing in any correctional facility is a challenge. So rather than keep fighting that challenge, we are bringing down our census to our state secure facilities to a level that approximates where the staffing is. So for instance, at Giddings, where you have 254 youth today, if our staffing is at 70%, why don't we have 202 youth there? In that same mindset, though, we have to specialize care for youth. We have to provide regional sources for these young people. Our partners that are strong and have evidence-based services can help us in that regard. So it's providing a capital request to the legislature in the next session that says we need smaller facilities. Of course, the movement away from that is a good example. Having the youth at MART isn't a long-term solution. We all know that. A long-term solution is a self-contained facility that might be much smaller, leveling and tiered to each youth having the right approximate service for their particular need, and that could either be a short-term crisis service or have a different module in a different part of the campus for the long-term youth. So it's presenting that package in terms of our next LAR.
Well, one area I certainly think is ripe for interim study and in the 84th session is the inpatient psychiatric hospital population. In recent years, there has been, for lack of a better word, an explosion of the forensic population, so individuals found incompetent to stand trial and folks adjudicated not guilty by reason of insanity. And as a result, many of the beds that were historically reserved for civil patients are being taken up by longer-term individuals. So I think this is a real, I think there's an opportunity here to kind of look at how we're using bed space. I think there were a couple of directives from the legislature to begin looking at that question. It certainly relates to this issue of criminal justice and mental health. Are we serving those individuals in the least restrictive setting? Are we effectively spending state dollars? And in addition, are we ensuring that there's front door access for persons who require non-criminal commitments or civil commitments? I think it's a big area of study that the state needs to undertake.